The NAOMI study was looking at people who, with chronic heroin addiction, who have not benefited in the past fully from the best available treatments. And we asked the question whether they would benefit from medically prescribed heroin given under supervised condition, whether that could provide additional clinical benefits to them versus just another attempt at methadone maintenance. And what we found was that medically prescribed heroin was very safe and effective and led to increased retention in treatment and better clinical outcomes, less criminal activity, and better health.
Being part of NAOMI, it got my life back together. I got another job. I started being responsible and taking care of myself. And
how did that benefit me? Well, that benefited me because it cleared my brain. You know, it just gave me an opportunity. That amazing stress that was in my life of having to find that drug every day was gone. It was just like this weight was lifted off my shoulder.
A lot of the adverse health conditions arise from the fact that people are injecting illicit drugs of unknown purity in unsterile conditions in nasty surroundings. And if you can replace that with a safe clinical surrounding where there's less opportunity for people to infect themselves with bacteria or with viruses, and if you can provide them with a known quantity of a known purity of a drug, then you've removed both the opportunities for bloodborne infections and for overdoses, and I think it's been demonstrated over and over and over again that this reduces illness and hospitalizations.
All the health indicators went up for everybody. You know, the crime rates went down. Everybody gained weight. Everybody was doing so much better when they were in a heroin-assisted treatment.
I didn't have to go out there and figure out how I was going to get the drugs, and I had help, like medical help and counseling and things there. It was great.
My brain started to engage again. You know, I was just living in this fog of a world. And I think that I really started to think. I was surrounded by people that were fellow addicts, and I saw improvement in everybody else. We had a staff of caring, loving people that were working with us.
And while heroin treatment is more expensive as a treatment than methadone, the savings you obtain in people going to the hospital less, using emergency rooms less, committing less crimes, those savings far outweigh the additional cost of the treatment. And when we looked at the data from NAOMI, we also found that heroin treatment is much more cost effective than methadone maintenance for this particular subpopulation.
And it's been demonstrated in the NAOMI project in Holland and in Germany and in Switzerland that when you provide people with a substitute therapy, they no longer need to engage in crimes of acquisition to purchase the drugs on the street. So it does reduce crime substantially, and because the intake of the drugs is always under a clinically supervised site, it's like a supervised consumption site, and basically we know that reduces the opportunities for HIV transmission as well as overdose and death.
There were no negative effects on the neighborhood. In addition, in Vancouver, we had a neighborhood advisory committee to let us know if there were any untoward effects in the local neighborhood, and their reports to us were always positive, that they saw no disruption as a result of the clinic.
I was recovering, in a sense. So the heroin-assisted treatment actually helped me in feeling better about myself, too.